Hi everyone, this is Dr. Karamachi. I wanted to quickly chat about what's in the news today. There's a lot of discussion about dexamethasone and how it can help you if you have COVID. There is a study, I think Oxford released it. They studied a group of around 2,000 people with severe COVID illness, and they gave dexamethasone. And they noticed that the patients who got the dexamethasone, their mortality improved so much that they had to stop the study prematurely, and they send the publication for peer review, and they want to publish this, where they're showing that people who get the dexamethasone, the brand name is Decadron. We use it a lot. It's a steroid medication. The people who get dexamethasone, if they have severe COVID illness, if they're on the ventilator, if they're on oxygen, they notice the significant improvement in the symptoms. Overall, it makes sense to me personally. There are a lot of doctors who believe that COVID-19 severe illness is more like high altitude illness. If you're on Mount Everest, or if you're into mountaineering, then you experience high altitude illness. And also, rationally, dexamethasone can reduce the cytokine storm and inflammation, which is how most people die in COVID. There's the role of hyperbaric oxygen. There are some scientists who are studying that concept in relieving COVID symptoms. We have to wait and see if that is a good treatment modality. But for now, I think a lot more docs are going to use the Decadron or the dexamethasone steroid in these people who are really sick, and hopefully it will cut down the mortality. In the paper, the authors are saying that it can cut the mortality by at least 1/3, which is phenomenal, if it is true. So, as over the last several months, we have been using a lot of medications, including the ICU doctors that I work with. They not only use the steroids, they use remdesivir. They use the immunoglobulin medications. So there are numerous medications that are using in these patients, and we really don't know what is helping them, but a lot more of them are surviving. So the only downside of using dexamethasone is it can cause stomach ulcers because it's a steroid. So in those people, we probably give them famotidine or pantoprazole as an antacid. This is only a short-term administration, so it should not cause major problems. In the long term, when the people take steroids, it can cause osteoporosis, where their bones can become weak. It also causes muscle weakness and excess gaining of the weight, especially in the midsection area of the body. But this study is actually short-term. It's only for COVID patients, especially when they're in the ICU. So I heard in the news that NHS, which is the major governing body in England, they're already put it in the protocol that they're going to have the doctors start using dexamethasone sick people who have COVID. In the United States, there is still some resistance. People are very wary, especially after what has happened with hydroxychloroquine. I think some doctors are still waiting. As I told you before, like my partners here and the IC doctors, they're pretty open to using these drugs, and they have been using steroids before in the last 3 to 4 months. So some exciting news, and I hope this is going to shift the curve, and hopefully, we'll be able to treat these people much better over the next few months. And this will also diminish the amount of fear that the general population has. I noticed there's a lot of concern that the number of COVID-19 cases are going up phenomenally in and across Florida. I'm not really worried if the cases go up. But what I'm really worried is the number of deaths, and the number of deaths continue to go down, which is good news. So if you have any comments, comment below. If you if you want to reach me privately, send me a DM. You can email me. I'm always available. I look forward to talking to you all again. Have a wonderful day. Bye.